One of the most common questions we're asked is, how long will this last? And usually what the patient or their family means is, what's the chance of me needing to have another surgery on that joint? The overall rate of ever having to have a revision or a redo surgery is less than 10% across all the population. Looking at it a different way, there's about a 1% risk that you would need another surgery on that joint per year. So 1% per year, that means 20 years after your joint replacement, there's an 80% chance or better that you're doing fine, or a 20% chance, or a little less, that you will have had or needed another operation. The most recent large worldwide study supports that claim in that 20 to 25% revision rate, or 80 to 85% of people are doing fine at 20 years. The results are roughly the same with shoulder replacement, where approximately 20 to 25% of shoulders will need to be replaced at some point during your lifetime.